Bad scars after brachioplasty, a prevention guide. My biggest concern is a scar. I had total knee replacement and both scars are barely visible. I love to have that with my arms. So that's one of the questions I got on one of my videos. Have you ever had surgery and wondered, about the scars? Are you considering an arm lift or brachioplasty and wondering how to minimize your scars? Now stay tuned and I'll give you the tips to make a major difference for you. Make sure you comment below. Are you worried about scars? And what worries you about them? Today we're going to talk all about scars on arm lifts. Now, the goal of any surgery is obviously to fix whatever the problem is and also to minimize any scar or any issues after surgeries. With an arm lift, you're going to have a scar that goes from your elbow down through to your axilla, and if we're doing an extended one, then it's going to go across the sideways. The management of the scar really starts before the surgery. So having proper nutrition, protein, vitamins to make sure that you're going to heal really well after the surgery is really important. And I get a lot of post-weight loss patients that have some sort of nutritional issues. So we want to make sure that you really get on top of those issues beforehand. During surgery, we want to make sure that we minimize tension in the actual superficial skin, and I do that by doing deep sutures that are holding the tissues together, and those deep sutures then prevent tension on the superficial layer of the skin. Then we're using subcuticular stitches that we don't have to remove. So normal stitches or clips or something like that can cause a lot of scarring in the scar. In the surgery, obviously, we're using a pico dressing. Now, some surgeons use the Dermabond glue. It's pretty much, I prefer the pico because it's a negative pressure dressing and has been shown to improve scars. It also gets rid of any fluid or gunk and can have some impact on infection rates. So that's during the surgery. Once we finish the surgery, the key thing there is the aftercare. So we have to look at making sure that you don't get infections. If you do get breakdowns, we fix those. And wound care, making sure the wound is clean and well maintained. The pico dressing stays in for about 1 week and then we replace it with a tape dressing. Tension again is really important, so preventing tension on the wound. And that's one of the reasons why we use the compression garments. So the compression garments helps get rid of some of the swelling so that you don't put too much tension on the wound there as well. Lymphatic massage to get rid of the swelling as well is really important to minimize that tension as well. At 4 weeks after surgery, I do silicone strips. So silicone strips, they are like dressing. So you put it on your wound and then that stays on for about 8 to 12 hours a day, and then you take it off at the end of that period and you can reuse it the next day. Usually 3 months is what I recommend. Each real strip will probably last you about a month or so. Sometimes they get really grotty and you have to change them. You can wash them as well. Once you're through that period, you're going to find that from 6 months onwards the scar is going to start fading in color, and the final scar is really more towards the 2-year mark, but really at 12 months it should be quite a faded scar. Hopefully this helps. It's all a process. Every single step in the procedure will help improve your scars, but scars are always going to be there, so that's something to keep in mind. Everyone has different kind of scars, so we might do exactly the same thing in 10 people and you get 10 different scars, and that's genetics, how you heal, your personal skin, how much sun damage you've had, etc. Oh, and the other thing is sunscreen is really important, or covering up the scars until they mature, because what happens if you get a lot of sun exposure is that you darken the scar and you can get a more prominent scar there as well. So thank you for listening. Be back in the next video.